बिस्मिल्लाहिर्रहमानिर्रहीम, अस्सलाम वालेकुम। मैं हूं नादिया बशीर, आपकी मेज़बान FM 102.2 रिफा रिहैब शो से। सामीन, वर्ल्ड स्ट्रोक डे ऑब्जर्व किया जाता है 29 अक्टूबर को, और इसकी एम ये है कि इससे ज़्यादा अवेयरनेस क्रिएट की जाए, और स्पेशली इन टर्म्स ऑफ वार्निंग साइंस के, इम्पोर्टेंस ऑफ टाइमली मेडिकल इंटरवेंशन, प्रिवेंशन के बारे में। और बहुत सारे स्ट्रोक पेशेंट्स या सर्वाइवर्स ऐसे हैं जो फेस करते हैं डिस्फेजिया यानी कि डिफिकल्टी इन देयर स्वॉल्विंग, जो कि सिग्निफिकेंटली इम्पैक्ट करता है क्वालिटी ऑफ लाइफ ऑफ पेशेंट्स आफ्टर द स्ट्रोक। आज के इसी शो पे हम बात करेंगे कि डिस्फेजिया के पेशेंट्स कैसे उनके साइंस एंड सिम्टम्स क्या है, और क्या रोल है स्पीच एंड लैंग्वेज पैथोलॉजिस्ट का, और कैसे हम उनकी मदद कर सकते हैं सो दे कैन वी कैन इम्प्रूव द क्वालिटी ऑफ लाइफ। इसी मौजू पर बात करने के लिए आज हमारे स्टूडियो में ज्वाइन कर रही हैं डॉक्टर हुस्मीला हुसैन, जो कि हेड ऑफ स्पीच थेरेपी यूनिट है इन क्वीन एलिजाबेथ हॉस्पिटल, और उन्होंने अपनी PhD की हियरिंग एंड स्पीच फ्रॉम यूनिवर्सिटी इन मलेशिया। शी हैज ओवर 20 years of clinical experience. She specializes in dysphagia management and has received advanced training from Isperth Hospital, Melbourne, and also from Singapore. Dr. Husmeela is deeply engaged in clinical supervision, teaching, and research with notable contribution to dysphagia therapy, head and neck cancer rehabilitation, and advancement of speech pathology in Malaysia. Let's welcome her to our show, and let's formally begin the our show. So, Assalamu alaikum.
Thank you, Ms. Nadia and Riphah Rehab Show for inviting me to share some knowledge about dysphagia management among stroke patients. I'm very honored to be here today. As a speech language therapist, I have seen how swallowing difficulties can affect not only patients but also family members. So today I would like to share some simple information and practical tips to help us understand this condition better and support our loved ones safely. Yeah.
So let's formally begin the show. And let me ask you, I would want you to define, explain to our viewers what dysphagia is, and how, it affects the overall health, or how common it is among the stroke patients to have dysphagia.
Dysphagia is derived from Greek word, dys meaning difficulty, and phagia means to eat. So dysphagia means difficulty to move food or liquid from mouth to food pipe.
Mm-hmm.
How common? Very common among stroke patients. Study by Martino in 2005 and Carise 2024 estimate between 51% to 86% stroke patients dysphagia immediately after stroke. So dysphagia is very common.
Okay, so could you explain to us that, dysphagia after the stroke, is it temporary or is it a long-term condition that the patients may face?
Okay, that's a good question. The swallowing problem after stroke can be temporary or permanent. Many patients have difficulty swallowing right after a stroke, but most patients improve over time. Mm-hmm. Study shows that about 86% of stroke patients have swallowing problems immediately after the stroke, but the numbers drops to around 13% after 6 months. This means that most of patients recover, but some may continue to have long-term swallowing difficulties and need ongoing therapy and care. Yeah.
Okay, so if dysphagia goes untreated, how does it affect the overall health of a person after the stroke?
Okay. It is important for us to understand the consequence of swallowing problems because they can affect both health and quality of life. So medically, dysphagia can cause aspiration pneumonia. The aspiration pneumonia means food or liquid entry the lung, which may lead to lung infection. So stroke patients with swallowing difficulty are at higher risk of death within a few months after strokes. So dysphagia can also cause dehydration and poor nutrition, leading to weakness, confusion, and slow recovery. So when the body does not get enough water or nutrients, the organs not function well. And this way, and the immune system becomes weaker, making patients more likely to get sick.
Okay. So what are the some of the
Psychologically,
I'm sorry, you can complete the sentence
Pardon?
because, okay, let's give it a few minute pause. Just a
Okay.
quick pause and then you can re-say it because I think,
Can
we,
start again. Okay.
exactly.
Okay. Okay. Yeah. I want to start again. When the body does not get enough water or nutrients, the organs not function well. And the immune system becomes weaker, making patient more likely to get sick. So psychologically, swallowing is not only important for health, but also for enjoyment and social life. Eating and drinking are often part of celebration and social gatherings. So when patient cannot eat or drink normally, they may feel sad, frustrated, and may choose to avoid any social gatherings. This can lead to depression. Okay. So
So, can you tell us like some of the common warning signs that the patient should keep in mind after that they have a stroke, that when they will start facing dysphagia? What are the some of the common signs they should keep in mind?
the most common warning signs, first, coughing or choking when eating or drinking, food or liquid coming out from nose while swallowing, wet or gurgling voice after swallowing, or patient feeling food stuck in the throat or chest. So patient who need multiple time swallow to finish one bite or one sip, or patient who keep food in the mouth without swallowing, or patient who drooling or licking saliva food from the mouth, or patient complain difficulty to chew food or taking long time to eat. Patient who unexplained weight loss or avoiding certain foods, or patient who frequent chest infection, or patient who fatigue or shortness of breath during meals.
Okay, so you talked about right now about the symptoms that the patients can look out for when they have stroke, that if they're having dysphagia also. But what about caregivers and the family members? What sort of signs and symptoms they should be able to look out for, or they should recognize when the patient is at home?
Caregivers can look for signs while the patient is having meal. If patient coughs or clear the throats often during meals, has a wet voice after meals, breathe quickly or looks tired after eating, keep food or liquids in the mouth without swallowing, or takes very long time to finish meal, these may be signs of swallowing problems. So if you notice any of these signs, it is important to see a speech language therapist for a proper swallowing assessment. It will prevent choking and lung infection and support safer eating.
Okay, so are there any silent sort of features that are associated with dysphagia that they do not become very easily noticeable?
Yes, some patients have what we call silent aspiration. This means that food or liquids goes into the airway without any coughing or choking. Normally, coughing is the body's way to protect the lung from food or drink. Normally, we cough if something enters the airway. But in this group of patients, that protective cough, but in this group of patients, that protective cough reflex is weak or absent. So they don't show any clear signs during eating. They don't respond as usual. As a result, this patient may seem to swallow normally but later develop frequent lung infection because food or liquid has entered the lung without anyone noticing.
Okay. So any potential complications if you ignore such symptoms and if they go unnoticed?
Okay. If swallowing problems are ignored, patients are at higher risk of lung infections such as pneumonia because of food or drink can accidentally enter to the airway. This can be dangerous and even life-threatening. This can be dangerous and even life-threatening. Without early detection, patient also miss the chance for early swallowing therapy, which can delay recovery and make it harder to return to normal eating.
So, how do healthcare professionals assess the swallowing difficulties in a stroke patients?
Okay, swallowing can be assessed in two ways: through a clinical swallowing evaluation and using instrumental procedures.
Mhm.
So we have first during the clinical assessment, the speech language therapist will check the structure, the strength and movement of the lips, tongue and throat muscles, then observe how the patient swallows water or soft diet. If the patient shows any signs of swallowing difficulty, instrumental procedure will be performed. There are two types of instrumental procedure, which are FEES and VFSS. FEES stand for Flexible Endoscopic Evaluation of Swallowing. VFSS stand for Video Fluoroscopic Swallow Study. In FEES procedure, a small flexible camera is gently passed through the nose to watch how food or liquid moves in the throat. While in VFSS, an extra video is taken while the patient swallow food or drinks mixed with a safe contrast we call barium to make it visible. This test helps speech therapists identify exactly what happens during swallowing and guide the therapist in creating safe and effective treatment plan for patient.
Okay, so what is the role of the speech and language pathologist in the diagnosis of dysphagia?
So our role in diagnosis of dysphagia, we determine whether patient safe or not safe to take orally. We identify what diet type patient can take safely. We also identify what type of strategies patient need to do to ensure safe for oral feeding, and we identify types of swallowing therapy patient need to do to normalize the swallowing physiology.
Okay, so are there any specific test or screening tools that a speech pathologist applies in a hospital setting to detect the swallowing problems?
There are many published swallowing screening methods. One of famous swallowing screenings or reliable test we call GAS. GAS stands for Gagging Swallowing Screen, developed in New Zealand. This is tool used soon after a stroke to check how safe it is for a patient to swallow different consistencies of food and drink. So the aim of this screening tool is to identify swallowing difficulty early, so healthcare professional can prevent complications like choking or lung infections. So how to do GAS protocol? There are two sections. One is preliminary examination, and second, direct swallowing examination. So during preliminary checking, healthcare professional will examine the patient alertness, ability to sit upright, and control of the mouth and tongue. If patient not alert enough or cannot sit, so the test might stop. Might stop because safety is a concern. The second step, healthcare professional will give a small amount of water to swallow, observing signs like coughing, throat clearing, or voice change. So if swallowing water is not safe, they stop and recommend for tube feeding. Okay, and if water is swallowed safely, they will try more challenging consistency like semi-solid, like thickened liquids and soft diet. This will help healthcare professional to see exactly which consistency patient can take safely. Okay, so based on the how patient does, healthcare professional will score they will receive a score. Okay, based on how the patient does in each step, they receive a score.
So how important is, or you can say like, why is it so important for the early detection of dysphagia in management of stroke?
Early detection of swallowing problem after stroke is very important. By identifying swallowing difficulty early, healthcare teams can decide whether a patient is safe to eat and drink by mouth or needs temporary tube feeding. This helps to prevent choking and lung infections, and also avoid unnecessary tube feeding for those who can still swallow safely. If patient fails the swallowing test, we can start early swallowing therapy, which greatly improves recovery. With early treatment and regular exercises, most patients can return to eating and drinking normally. Swallowing problem happen because the part of the brain that controls swallowing is affected by the stroke. So over time, the brain can heal and adapt, what we call a process neuroplasticity. So allowing other areas of the brain to take other, over time, the brain can heal and adapt a process called neuroplasticity, allowing other areas of the brain to take over the swallowing function. This is why many patients recover within 6 months, though those with severe or brainstem strokes may continue to have difficulties.
What are some of the effective rehabilitation approaches for stroke-related dysphagia?
The main goal of swallowing rehabilitation is to find out what part of swallowing process is weak and then choose the right exercise to strengthen it.
So what are the most effective rehabilitation approaches for stroke-related dysphagia?
Once we identify the problem, we match it with the right exercise. For example, oromotor exercises help strengthen the lips, tongue, cheeks, which are important for chewing and moving food in the mouth. So this exercise may include tongue movement, lip closure practice, and blowing task. So we have also the effortful swallow. Effortful swallow exercise helps strengthens the throat muscles. The patient is asked to swallow hard, like swallowing a big golf ball, to make the muscle stronger. The muscle core exercise help improve tongue and throat coordination. So the patient stick out about 1/3 of the tongue and swallow while keeping it out. The Medicine maneuver trains the muscle that lift the voice box. The patient swallows, feel the Adam's apple, move up, hold it for 2 seconds, then release. So we also have the shaker exercise, strengthen the neck muscles. The patient lies flat and lifts only the head to look at their toes. The chin tuck against resistance, sitar, use a small ball under the chin. The patient needs to press the ball using their chin to build the strength. In addition to exercise, there are also advanced therapy such as neuromuscular electrical stimulation. This therapy with gently electrical pulse are used on the neck muscles to help retrain swallowing muscles. We also have which electrical signals are delivered through a small tube placed in the throat to help activate the swallowing muscles. With the right combination of exercises and technology, many stroke patients can regain safe and effective swallowing.
Okay, so could you give us some simple techniques, like the simple feeding techniques that caregivers can use at home?
Okay. Caregivers play an important role in helping patients eat and drink safely. Here are some simple strategies to follow at home. First, make sure patient sit upright. So always make sure patient is sitting straight at least 90 degree during meals and for 30 minutes after eating. This helps prevent food or drinks from going down the wrong way. So second technique, small bites and slow pace. So caregivers can give only small amounts each time instead of patient drinking with a straw, use spoon for better control. Then caregivers can modify the diet. Choose a texture that is safe for the patient. For example, blended porridge or soft food for weak throat muscle, or use thickener products if thin fluids like water cause coughing. Encourage swallowing. If you notice the patient holding food, not swallowing immediately, gently remind them to swallow. Multiple swallows technique is one of good technique. The technique that we encourage patients to swallow twice if they feel food still stuck in the throat. Cyclic ingestion, what we do, alternate between small bites of food and sip of drink to help clear any residues from mouth or throat. And then lastly, family members can reduce distractions. Keep the environment quiet and calm during meals so that the patient can focus on swallowing safety. These simple steps can make eating safer and more comfortable and help prevent choking or lung infection.
So the next question can be how we can modify the food texture or a liquid consistency to help patients that have, they've gone through stroke.
Okay, this is a good question. Many patients with swallowing problems cannot handle thin liquids like plain water because plain water flow too quickly. Many patients with swallowing problems cannot handle thin liquids like plain water because they flow too quickly and the patient may not have enough muscle control to swallow safely. That's why we often use thickened liquids. Thickened liquids make drinks move slowly, giving the patient better control and reducing the risk of coughing or choking. For patients with weak throat or swallowing muscles, we also modify food texture. For example, they may eat soft or blended food like porridge instead of normal rice. Softer food is easier to chew and swallow safely compared to normal rice or normal diet. By changing the texture of food and drink, we can make eating safer, easier, and more comfortable for stroke patients.
Okay, so can we use some sort of a technology or an assistive device that can help us support safe swallowing in stroke patients?
Yes, there are several technologies and assistive devices that can support safe swallowing. For example, the Provel cup. You allow patients to take a fixed amount of plain water or steamed fluid, usually 5 ml or 10 ml each time. So this helps patients better control the amount of water they drink and reduce the risk of coughing or choking taking plain water. There are also adaptive utensils that make it easier for patients to hold and eat, especially if they have weak grip or limited hand movement. In addition, there are mobile apps like Swallow Prom and Swallow Rehab that guide patients through home exercises. In addition, there are mobile apps like Swallow Prom and Swallow Rehab that guide patients through home exercises, send reminders, and provide information and support for swallowing therapy. Yeah.
Thank you so much, Dr. Husmeela, for joining us all the way from Malaysia. Just before you go and we end the show, I would like you to send out a take-home message for the people that are listening to our radio show today.
Okay, I would like to highlight to family members to seek help from speech therapists if they found their loved ones show symptoms of dysphagia at home.
Thank you so much, Dr. Husmeela, for joining us once again. And I hope this show is going to be beneficial for all of you out there listening to it. अगले हफ्ते हम फिर मिलेंगे एक नए मौजू के साथ, एक नए मेहमान के साथ. तब तक मुझे इजाज़त दीजिए. अल्लाह आपका हामी नासिर हो. अल्लाह हाफिज़.